Hello, this is Menezes and I'm one of the expert OET tutors working for Triada International Academy, Mangalore. So today I am here in order to explain certain frequently asked questions regarding the OET writing. So we know that in OET writing we have got one particular case notes which is given you in the nursing notes form. So what you have to do is you have to expand this particular case notes and make it like a summary for the reader to understand it in a better way. So during this writing module of yours in the examination, you will be given 5 minutes for only reading the task. Now during this 5 minutes, the OET examiners will be conducting the exam. They will make sure that you will not be given any access to any of the articles like maybe a pencil, a pen. You are not allowed to use anything. So this 5 minutes is only given for you in order to understand and read what basically the case notes and the situation is talking about. Now, the next 40 minutes that have been given to you is for the writing. But you should also remember that you should not keep all this time for the writing because it's really very important to read what you have written at the last. Because proofreading is that particular stage which will help each and every OET candidate to pull their letter from a C grade to a B grade. Because as being human beings, even though we have got a very good hold on English language, during the flow of the writing, there are always instances where we do certain wrong things. Now, let me go in detail regarding those frequently asked questions for you. Let's come to the board. The first question that many people have doubts is, what date do I write? Now, you have to understand that when you are writing the letter on the test date, usually you get to write that particular date itself, which is of the test date. Because some people have got certain confusions because whatever the sample letters that you will be practicing during your coaching or maybe when you are learning about OET, those sample letters are something which have been already appeared in the exam. So basically they are the past letters. So you don't require to worry a lot regarding this confusion with the dates, because when on the examination day when you are appearing, you will 100% get only to write the examination date as the today's date. Now, the second thing is, where do I write the date? Now, many people have got confusion because of this particular thing. You don't require to take a lot of tension about these things because there are a lot of other criteria which will be deciding your scores. But just to make a brief explanation, I would say that either you can write the date at the top, or you can also write it below the address and above the first salutation where you address the reader like dear, and then you write his particular name or the first salutation. So these are the two preferable places where you can write the date. The third FAQ that is, what happens if I write too many or few words? After this new criteria came into the existence, basically nowadays the OET readers, they don't, the examiners, they don't see that whether you have written exactly like 180 to 200 words. But you see, if you are writing too much, like if you are crossing the limit of maybe about like 230 words, somewhere it's very sure that you have included something which is unnecessary for the reader. So you should be very clear about it. And if you are writing very less, consider that you are not writing about 180 words and you are only concentrating about concising your letter to about 160 words, then there are high chances that you must have lost some important information that the reader would have required in that particular situation. Because you see, when your question paper or the case notes has been organized and given to you, the OET people, they make very sure that you will be having enough stimulus to make up a letter which is almost consisting of about 180 to 200 or maybe about like 180 to 230 words. But my kind request is that try to write at least like 180 words, because the examiner should have at least a minimum content in order to evaluate what you have written. So the next important FAQ that we come across is that, what should I call the reader? Now, it basically depends upon the situation, because you being a nurse, you will be writing to 12 different professions. You know that you come across, like when we are doing our duty schedules, like we come across like a lot of other health professionals, maybe like a doctor, a dietitian, a physiotherapist, an occupational therapist, a social worker, maybe a veteran. So, it depends upon that particular situation as well. For example, imagine that you're writing for the doctor. Then if at all the name of the doctor has been given, you can directly call that particular person, like you can, in the salutation, you can write dear doctor and his name. For example, dear Dr. Williams. And in case if at all like you don't want to write as a doctor, you can still write like dear Mr. or whatever the depending upon the gender. For example, if it's a male, then you can write like dear Mr. Williams. That's also fine. And in case sometimes when the name is not given, like they directly say that you have to write for a GP, where the name of that particular person has not been given to you, you can write dear sir bar madam, because you don't know like whether you are writing for a female or maybe you are writing for a male. So just to make sure that to whomsoever you are writing, you can write like dear sir bar madam. Now the next FAQ is like, what should I call the patient? Now, you come across three different kinds of categories here. Now, the first is like the female. Now, for the female, we can say that, we have got Mrs. and Miss. Now, when we say about the Mrs., people who are married and even people who are widowed. So, you can still address them as Mrs. Whereas, preferably, we would call Miss for people who are maybe a single parent who is a divorcee, or like maybe like a single who is not married at all, so you can call them as Miss. Now, the another kind of usually we come across is below the age of 17 years. Now, below the age of 17 years, now this is considered to be people like we require to call them with their first name, even though they are master or a Miss, like MISS Miss. So, in that case, try to address the patient with their first name. Now, the next important thing is that, can I use abbreviations? You can use abbreviations, but you should be really very careful about it, because when you're writing for certain readers, one of the criteria of the updated writing module, they are very specific that the abbreviations that you're using, it should be like relevant for the reader. Because for example, imagine that you're writing for a social worker. Social worker is still okay, but still just imagine you're writing for a lay person, like maybe a veteran. So in that case, if you're sending some complicated abbreviations, obviously that person will not be able to understand, and that will create a gap in your communication, because of which there are high chances that you will be having lower grades. So you can use abbreviations, and abbreviations only which are standardized, only those abbreviations you can use. For example, for blood pressure you can use as BP. Maybe for you can say like for diabetes mellitus you can say DM, or there are many other abbreviations, like maybe for an occupational therapist you write OT. So only the standard abbreviations can be written, and those abbreviations which are not universally accepted, please try to avoid them. My one other suggestion is that if you have doubt regarding the abbreviation, try to write the full form, because it's always better to be on the safer side rather being on the risky way. Okay. The next thing is, how am I scored? Like how much score do I need to get a B or a 350 score? So basically this totally depends upon the updated new criterias. Now we all know that priorly there were only 5 criterias, and depending on those 5 criterias, the examiner would have assessed you. But after the updation, we have got now 6 criterias. But whatever the 6 criterias may be, it will be revolving around that these 3 important components. Basically, to whom you are writing, that is the profession. The next important thing is about the purpose, on in which situation you are writing the letter. And the third thing is the patient known or an unknown client. Now regarding this, we will be having another video where we will be explaining you everything in detail. Now I will just say about the 6 criterias. The first criteria, the updated one, is about the purpose. The second, we have got the content. The third one, we are getting the conciseness and the clarity that you are providing to the reader of your letter. Then we have got the genre and style, which basically talks about the tone that you're using to convey the message, and we can say the formal tone. And then we have got the organization and the layout, how you are going to organize things and how you are making the layout for the particular reader in order to understand or in order to communicate in an effective way. And then at the last we have got language, which will consist of vocabulary, spellings, grammar and punctuations. So I hope I have cleared all the FAQs that have been recently asked. For more information, please visit Triada International Academy, Mangalore.